Okay, so you are experts at the skull, and now we're going to continue down with the rest of the axial skeleton. So remember that the axial skeleton is the skull plus the vertebral column and the thoracic cage, which is your rib cage. Everything else is part of what's called the appendicular skeleton. So, and I guess I should mention the hyoid bone, this little guy right there, is also considered part of your axial skeleton. It's kind of a bone in and of itself, very strange, but everything else, that is your axial skeleton. So obviously here in my room here, I don't have a whole skeleton, so I'll have to show you that on AP Revealed. But I do have some individual bones, and so we're going to be learning all of these vertebrae and the features of these vertebrae. So very, very interesting to look at. And you know, to me, it's a lesson in evolution. I love to look at all the little nooks and crannies and see how the form is following the function. Or maybe it's the function following the form. I think the former. So anyway, let's get going with these. We're going to start with the vertebral column. So let's go on down here to vertebral column. And you'll see that we have a posterior view, a lateral view, and an anterior view. And you know, they look straight from the anterior and posterior view, but when you look from the lateral side, you can see the spine is kind of S-shaped. We all know that, right? It kind of goes with the sound effects, of course. But it's actually very interesting, and it's all adaptations for being able to walk upright. So we're going to break this down and know that there are actually 4 major areas of the spinal column. So let's take a look at these. So let's first look at our, well, let's look at the curvature of these. So each little curvature actually has a name. So this first part would be the cervical curvature, and it's concave, meaning it's like an open bowl of soup. Whereas if you then go down to the thoracic curvature, it goes the other way. It's convex, so it's like an upside down bowl. And then you go back to the lumbar area. So let's go to the lumbar curvature, and that is back to being concave. And then we go on down to the sacral region, to the sacral curve, and that's back to being kind of convex-ish, I guess I would say. So it's like an S, it just, you know, it's like a snake. But here's what's fun. Let's go back to the cervical area. Let's start at the top and highlight our cervical vertebrae. So there are cervical vertebrae, and there are 7 of them. So this is one of them. This is C1. This is your first cervical vertebra, called the atlas. You're like, the atlas, why do they call it the atlas? Well, remember those occipital condyles on the inferior side of the skull? And I told you that those are responsible for you being able to put your head up and down, and that they articulate with the superior articular facets of the atlas bone. So this is very, very interesting. Those occipital condyles fit right there, and they're able to rock back and forth so that you can move your head up and down. So that's C1, and C2 is also a very strange looking cervical vertebra. It's called the axis bone. It has a little process that sticks straight up, perpendicular to the rest of the bone. And that's called the dens. So we'll get into these in a little bit. So now there's 7 cervical vertebrae. So the atlas is C1, the axis is C2. The rest of them look quite different from the rest of them. And why are these important? Well, this is obviously going to maintain your neck support and your head support. So it's kind of like in Greek mythology, Atlas was the guy that held up the world. So hence, C1, the atlas bone, holds up the world, the skull, right? Makes sense. Now there's 7 cervical vertebrae. So a good way to remember how many vertebrae are in each of those first 3 areas, the cervical, the lumbar, or the thoracic and the lumbar, it's like you eat breakfast at 7 o'clock in the morning, you have lunch at 12 and dinner at 5. So 7 cervical vertebrae, 12 thoracic, 5 lumbar, and then you have your sacrum at the bottom. So that's kind of a way to learn this. So that's your cervical vertebrae. There's 7 of them. Let's move on down to the thoracic. So the thoracic vertebrae are very important because these guys articulate with your rib cage, your thoracic cage. So the ribs are actually going to attach to the thoracic vertebrae and reach around and then attach to your the costal cartilage, the cartilage of your rib cage. So those are very important. Again, there's 12 of them. They're slightly thicker than the cervical vertebrae. So we'll go over the parts of the different of these vertebrae in a minute. And then the last area, of course, is your, before the sacrum, is your lumbar vertebrae. And there's 5 of those guys. You eat dinner at 5. And these often cause people backache, right? But they're huge vertebrae. I mean, check this out. They're huge, huge bodies of these vertebrae here. So they come in, you know, various sizes and shapes, but huge, totally huge, huge, huge. And so these guys bear all that weight and gravity. All of everything above it is just bearing down on these guys. And that's why people, as they age, you know, the fibrocartilage discs between the vertebrae can start giving them problems, and they have lower back pain because these lumbar vertebrae are bearing the world. And then finally, we get to the sacral region. Where's my sacrum? Right there. Okay, so here's my sacrum. And what it actually is fused vertebrae. This is very cool. I mean, you can actually see where these vertebrae had fused during development. And it's kind of interesting to study other vertebrates and see tails, because we have just a remnant of a tail, this little piece hanging off the sacrum called the coccyx. It's actually its own little area. So let's see if we can find the coccyx here. So that's your coccyx, your tailbone, and this breaks pretty easily. So, and it also is fused vertebrae here. So, you know, in other animals, this thing is really long and becomes a tail. So we're going to learn the different parts of the sacrum as well. But, you know, you can see that this kind of makes your seat, makes your little tail area there. Okay, so let's take these vertebrae individually if we can. Well, here, this just to highlight your intervertebral discs. You know, they're made of fibrocartilage. So those are between each vertebrae. Those are shock absorbers, obviously. And you can also see some features that we'll be breaking down later, but all of the sides of these vertebrae have areas for nerves to pass through. And these are called your intervertebral foramen, or foramina. And so you can see them going all the way down here. And then the other thing you can see from your spine is the typical sticks pointing out, and those are the spinous processes. So those are the spinous processes of your vertebrae. So each vertebra, with the exception of the atlas, has a spinous process. Now there's one spinous process that you can actually palpate and feel. So right, that little bump in the back of your neck is really easy to palpate, and so it's called the vertebra prominens. Prominens. That means prominent vertebra. So it's right there. Okay, so that is actually your 7th cervical vertebrae, C7. All right, are we ready to break this down? Let me just make sure I didn't miss anything I could show you right now. I think that's good for now. Let's go ahead and look at these individual bones. Okay, we are going to start with C1, cervical vertebra 1, which is the atlas bone. That's right here, okay? So let's make sure that we're looking at the right side here. So I'm looking right here is a cervical, is the superior view of this. So this is where the occipital condyles would meet in here. And let's look at all the different parts of this guy. So first, up at the top, we have the, and I'm going to turn this backwards from me so that you're looking at the superior view, which is what you see on the screen. So this whole top area here is called the anterior arch. So anterior arch
of atlas.
Okay. And at the very tip of that is a little bump, and you know little bumps are called tubercles. So this is your anterior tubercle.
Anterior tubercle of atlas.
Okay. Obviously the whole bone is the atlas, so I don't need to say anything else of that. And then all of this stuff here, all of this is called the lateral mass of the atlas bone. So that's all the lateral mass. And down at the bottom, of course, would be the posterior arch, which would mean that you also have a posterior tubercle at the very end. So posterior tubercle. Now at the very tops of that lateral mass are 2 like little divots, smooth divots, and that's where those condyles are going to articulate to. Well, a smooth divot is called a facet. And so these are the superior facets of the atlas. And all these vertebrae are going to have superior facets to articulate with the bone right above them. Okay, and then the holes to the side, obviously where nerves are going to go through. These are your transverse foramina. So transverse foramina, so we got pegs going through there. And the whole little point out here is called the transverse process. So remember, transverse means horizontal. So that's the transverse process. And then right smack in the middle, this is the vertebral foramen of the atlas. So this is where your spinal cord is going through. Okay, so not so bad. Let's turn on our layers here. So that was your vertebral foramen, anterior arch, anterior tubercle, lateral mass with its superior facet. So superior articular, because it's articulating, facet. Your transverse process with its transverse foramen. The whole thing is the atlas. There is your posterior arch and the posterior tubercle. Not so bad, right? Atlas bone, piece of cake, holds up the world. Let's move on down to C2, which is your axis bone. Going down to the C2, axis bone. Here it is. And this is a posterior superior view. So basically, you're looking like, from your point of view, it would look like that. So remember that I said this thing has a very unique little process there, and that is called the dens. So this is the dens. And the dens is very important because this is going to allow it to articulate with the C1 atlas right above it. So these babies just fit perfectly like a hand to a glove. You line up your superior articular facet of your axis with your atlas bone. That dens has a nice little place by that posterior tubercle to just fit in. And look at those guys. They just fit together perfectly, hand to glove. How beautiful is that? And the axis, that dens, is really important because this allows the atlas to turn like this. So this allows you to turn your head side to side. Very, very, very important, right? So this is really important. So that's the dens. The whole body of the axis is right there. So now we have inferior articular processes and help to articulate with the next vertebra below it, but it's also the opposite of the one up here, which is your superior articular facet. So if I click that, you can see that's the kind of counterpart to the one over there because that's going to articulate with the atlas bone right above it. Now let's look at these transverse things. So your transverse process is right there. So very similar to what you had with the atlas bone, you also have your cute little transverse processes over here with them, the transverse foramen where nerves are going to go through. Here is your vertebral foramen. We all know that. Your spinal cord passes through there. And down here is your spinous process of your axis bone. So it's not as prominent as what you'll find further on down, but you have both a dens and a spinous process. So that's something to keep in mind there. And let's see, pedicle of the axis. So this was your superior articular facet. This right here is called the pedicle, which means little foot. And then kind of the arms by the spinous process are called the lamina. So lamina. And I think you pretty much got the main things of this guy. So let's turn on the tags. So this is your dens, superior articular facet, body of the axis bone, transverse process, transverse foramen, inferior articular facet, lamina, there's your whole axis bone, and this is your spinous process. Not too bad, huh? Not too bad. All right, and then pretty much the cervical vertebrae below there are going to be kind of similar. Here's a typical one. I think I didn't bring one of these. But anyway, let's take a look at the cervical vertebrae. So notice the spinous process of cervical vertebrae tends to be a little different than it is further on down. Here's the body. So here's a superior view and a lateral view. So there is your body. Here's the whole cervical vertebra. Inferior articular process, you can see from the lateral aspect. Lamina. So remember that the lamina are always kind of the arms by the spinous process. Pedicles of the cervical vertebrae. You know that, right by the superior articular process. There's your spinous process. There's your superior articular facet that's going to articulate with whatever vertebra is right above it. Okay, so there's that. Your transverse foramen and the transverse process that houses them, and your vertebral foramen. So those are your cervical vertebrae. Wow, we're just zipping along here for these, which is really a good thing. Now let's take a look at our thoracic vertebrae. This is really important. So these guys also have the same basic features, but slightly different. So remember, thoracic vertebrae are the ones that articulate with the thoracic cage. So these guys are going to have special little areas for articulating with ribs. But check out that spinous process. I mean, that is a process. That thing is beautiful. Check it out. I can't even wait. Let's highlight him. Okay, so there's the spinous process, superior view. Let's look at your pedicles, right? You know those, and your superior articular facets. So these are all the same. You're like, okay, I'm getting it. I understand these things. We can look at our lamina. Those are obviously right by the spinous process, and you know the body of your thoracic vertebrae. So you're like, okay, I can see that the body is thicker than it was in the cervical vertebrae. Things are shaped a little different. Okay, makes sense. But now is the interesting part where these guys, because thoracic vertebrae, all 12 of them, these are the only ones that articulate with ribs. So here, look at this, right down here on the lateral view. That is your inferior costal facet. Inferior, it's at the bottom. Costal means rib. And it's a facet, which means it articulates to something. So this is one place where ribs are going to attach to the thoracic vertebrae. Very, very important, but they're not the only cool place. So check out, you know that if there's an inferior costal facet, there has to be a superior costal facet. And you can see this from both the superior and lateral views. That is another point of attachment for ribs. So we have both inferior and superior costal facets on thoracic vertebrae. Very, very, very important. All right, and the other stuff you already know, right? Vertebral foramen, where the spinal cord goes through, transverse processes, they're kind of strange shaped, and you guys know this, okay? So you already know all these things. Let's see if we missed anything. I think that's it. I think you got all the parts of the thoracic vertebrae. And moving on down to the lumbar vertebrae. Now these are the big guys. Look at these lumbar vertebrae. I mean, these have bodies that are just huge. And, you know, kind of the rest of it's shrunk and the body is big. And that's because it has a lot of weight and compression on it. So these guys have to be big. And, you know, someone with osteoporosis, these bodies of the vertebrae all along can actually break pretty easily. So, you know, but again, people can, as the discs, fibrocartilage discs deteriorate, people get a lot of pain in their lower back where their lumbar vertebrae are. So let's do some of the ones you already know. Obviously, you know where the body of the lumbar vertebrae is. You know the lamina, which are right by the spinous process. You know, these ones are pretty, we're kind of back to vanilla here, back to general. Okay, so you do have inferior articular processes, but these are not articulating with, well, they're just articulating with the bones below them. Your pedicles, your superior articular facets, your transverse process, and you already know your vertebral foramen. So that's all pretty much the same as everything you've learned. So the only weird ones are those thoracic, and we'll study the ribs so you can see kind of how those are going to articulate. Finally, let's go down to our sacrum and coccyx. Okay, so that's this right here. So sacrum and coccyx. Notice the muscle attachment that's going on there. We have a lot of muscles around this area. Let's pull it off, put it on the tags. So we're looking at an anterior view and a posterior view. So let's start with the posterior view. Notice these big flat areas on the side. Those are areas that are going to articulate with the pelvis of the appendicular skeleton. They're called auricular surfaces. Auricular surfaces. These are articulatory, I think I just made up that word, articulatory surfaces of this. But anyway, the point is the pelvis is going to articulate here. So this is the auricular surface.
Auricular surface of sacrum.
Of the sacrum. Okay, so, and auris means ear. So they're kind of like the ears of the sacrum. But it's going to articulate with a part of the pelvis called the ilium, which you'll be learning about soon. Okay, what else? But the ala up here, ala. Ala, A-L-A, means wing. And you're like, wait a minute, I thought ptera meant wing. Well, yes, it does. They both do. But this is the ala, the wings of the sacrum. And let's see, did I miss any comments on that? Base of the sacrum. Okay, yeah, ala means wing. Pretty much what we just said. Okay, flipping it over to the anterior side. So all these foramina here. Wow, look at those. Lots of holes, lots of nerves going through. On the anterior side, they're called anterior sacral foramen. Ha, pretty easy, right? Not hard. Guess what it's called if you put it on the posterior side? Posterior sacral foramen. Okay, so you got those, anterior, posterior. But now let's look at the posterior side and see all these ridges here. This actually sticks out. It's a crest. It's a crest. So it's a crest and it goes down the middle of the sacrum. Therefore, it is a medial sacral crest. Medial sacral crest. Can you see that? Medial sacral crest, right down the middle. So that's the medial sacral crest. We don't have that on the anterior side, as you can see. But something else interesting here, and unfortunately my cast doesn't really have it, but this real bone does. Look at this little thing here. Isn't that cool? That right there, and they stuck a peg in there for you so you can see it's hollow, that is called your sacral hiatus.
Sacral hiatus.
Hiatus means stop, right? If you put a hiatus to something, you're putting a stop to it because that is the end of your spinal cord in there. That is where it all stops. So it says transmits the filum terminale. So the filum terminale is the end of your spinal cord. Okay, so that is the end of your sacrum right there. Now let's start looking up some more. So the whole thing is your sacrum. Let's just go down here. So we went through these two. Went through the ala and the auricular surface. We already said that's your anterior foramen of the sacrum. And that was your medial sacral crest. And those are your posterior sacral foramen. Now look at this. Promontory. So on your anterior side, promontory of your sacrum. This is what articulates with your last thoracic vertebrae, L5. I mean, not thoracic, lumbar. Your last lumbar vertebrae is L5. And so that is very broad, very thick, because it has to support a lot of weight. So it's the landmark for establishing female pelvic dimensions, but because that's a really important point there, really important part. Okay, now at the very bottom here, you're left with two little things. Those are little horns, and so they're called sacral cornua, because cornua means horns. So they're like the little horns of the sacrum, and they come right at the horns of the coccyx. So let's take a look at our little coccyx here. Come on, coccyx. Do we even have you on here? Well, it's not going to highlight just the coccyx by itself, but all this is the coccyx. And it has little horns here. Oh, actually. Yeah, unfortunately, it's not showing me those. Oh, here we go, coccyx. Okay, so here's your coccyx. And the little horns at the top are called the coccygeal cornu. Cornu means horns. So coccygeal cornu. And it's going to, these horns of the coccyx articulate with those sacral cornu of the sacrum. So you got some horns articulating with each other, which is pretty cool. But those are really, really interesting. That's your coccyx. And again, that bone can break really easily. And then, of course, off to the side, the transverse processes. Not too bad. I think you guys can learn these very, very easily. All right, are we missing anything? I think you got the whole vertebral column. Good job. Very, very good. So let's do a quick practice. I'm going to turn on the tags. What is this? anterior view of the sacrum, obviously, and here's the whole sacrum. Over here, this is the ala of the sacrum from the anterior side. Here's the ala from the posterior side. This is your promontory of the sacrum and your anterior foramina right there. This obviously is your coccyx. We have a transverse process of your coccyx and a coccygeal cornua. We have little horns coming off the posterior side of your sacrum, and these are your sacral corni, or cornua. This is your sacral hiatus, medial sacral crest, posterior sacral foramen, auricular surface of the sacrum, and your superior articular process of the sacrum. All right, that is the vertebral column. Good job. Good job. A little bit more to go on this axial skeleton. Let's go ahead and do the ribs and the thoracic cage. You can see lots of points of muscle attachment. Bringing it on down and looking at it from ribs and features. So you have 12 ribs. And here's a little piece of a rib cage where we've taken off the ribs. So you have your sternum, the costal cartilage, that means rib cartilage coming off of it, and then of course the ribs themselves that are going to articulate with this costal cartilage. Now there are a total of 12 ribs, but the first 7 of them are considered to be true ribs, while ribs 8, 9, and 10 are false ribs because of the cartilage. So ribs 1 to 7, the cartilage that attaches to them attaches directly to the sternum. Ribs 8, 9, and 10 all share a common origin of the cartilage, and for that reason they're called false ribs. And then ribs 11 and 12 actually don't have cartilage at all. They're called floating ribs. They're easy to break, actually. And they kind of just float around without any cartilage. They're not actually attached to the sternum. And then we're going to learn the parts of the sternum as well. So let's go ahead and look at rib 1. So rib 1, way at the top, is a little itty-bitty thing. And he actually has kind of a notch in him that will allow for the subclavian artery and vein to go through. So this guy is going to attach right here. And here's that costal cartilage number 1 right there. And then here are your true ribs. Well, here's all the ribs. This is all 12 of them. But going on down 1 through 7 is your true ribs because they're hooking to cartilage that directly feeds to the sternum. Whereas the false ribs, 8, 9, 10, they all kind of feed off of branches of the same line of the costal cartilage. And then we have ribs 11 and 12, which are, where are those guys? I don't even see 11 and 12 on here, but these guys, they don't have those. They're called floating ribs. Oh, there they are. There's your floating ribs, 11 and 12. So they're not hooked to cartilage at all, don't touch the sternum, easily broken. Now let's look at the parts of the sternum. Okay, so all this thing here is your sternum, and the middle part would obviously be the body of the sternum. The head is called the manubrium, and the manubrium is very important. It has a little notch here, and that's called the jugular notch of the sternum. And what else? Then we go all the way down to the bottom and we get the xiphoid process. And so for most of your life, this thing is cartilage. And it's actually a landmark point for doing CPR. You like try to find the xiphoid process, and that's kind of where you put your hands for CPR. So here's your whole sternum, xiphoid process, manubrium with its jugular notch, and the body of the sternum. And then there's like a line. So if you can see here, so let's go back over this again. Xiphoid process, body of the sternum, manubrium, and now there's a little line that goes right between the manubrium and the body. And that little baby, it has a name, and it's called the sternal angle. So that's your sternal angle. Pretty easy, right? Not too hard. So here's your whole thoracic cage. So notice it's the ribs, the costal cartilage, the sternum. All of that is, and the thoracic vertebrae that it attaches to. So all of that is your thoracic column. Okay, so It's your thoracic vertebrae right there, so you can just kind of see how they all attach. So here's just another view showing you your 12 ribs and your costal cartilages that 10 of them are attached to. A little more detail about the ribs and how they articulate with the thoracic vertebrae that they're associated with. So you already remember the parts of the thoracic vertebrae, right? So let me get out my trusty little pen here and let's see what we can do. So you'll remember this is your spinous process right there. Come on, pen. So there's your spinous process, and this is your transverse process. Now check it out. So here's your rib, and notice that your rib actually has some features on it. So here's a little bump, and we know that a little bump is called a tubercle, but in this case this bump is very angular, so it's actually called the angle of the rib. So this is the angle of the rib, whereas down here where you have this little flat area, this is your tubercle. So this is the tubercle of the rib right there. Here's your head, this is the neck, and this is the shaft. Not too bad, right? And then down here is an area for articulation with the costal cartilage. So that means that this baby is fitting like this, right? The angle would be pointed superiorly to line up with the, or actually posteriorly to line up with the spinous process. So anyway, there you go. So you've been through the ribs, you understand how they articulate with the thoracic vertebrae. So, and a good way to study that is actually in lab, get that full skeleton and kind of look at the ribs and how they're oriented and how they articulate with the thoracic vertebrae. But you know what? I think you guys are done with the axial skeleton. Good job. I'm really proud of you. So you guys are ready to go on to the appendicular skeleton with all the long bones that you know how they form now. So good job. Keep up a smile and keep plugging along in anatomy.